I am Dr. Selena Clarke, a board-certified urologist with more than 15 years of experience helping men over 50 restore vitality, circulation, and hormonal balance. Natural, let me ask you something very directly. When was the last time you noticed your body didn't respond the way it used to? Not just in energy, but in firmness, fullness, or confidence during a private moment. If you are over 50 and you've quietly thought something feels smaller, weaker, or slower, you are not imagining it. But here's the truth. Most men are never told that change is not automatic aging, and it is not permanent loss in the majority of cases. It's a circulation problem, not a failure of your body. And today I'm going to show you how one overlooked item already sitting in your kitchen can help reopen those blood flow pathways safely and naturally. Most men assume the only options are prescription pills or expensive supplements with bold promises and small print. But what if the first step to restoring vascular fullness isn't adding something new, but correcting an internal imbalance that quietly tightens your blood vessels year after year? That imbalance is something I see constantly in men over 50. And once it's addressed, the body often responds better than you expect. If this topic feels personal, that's because it is. You are not broken, and you're definitely not alone. In this video, I'm going to walk you through a simple 5-step approach centered around baking soda, sodium bicarbonate, and before you roll your eyes, stick with me. We are not talking about magic or extremes. We are talking about optimizing your internal environment so your blood vessels can do what they were designed to do. By the end, you'll understand why so many men mistake restricted blood flow for permanent decline, and how small, consistent changes can restore confidence from the inside out. Before we go further, I want you to do 2 quick things. First, drop a comment and tell me where you're watching from. I read those, and it helps other men realize this is a global conversation, not a private struggle. Second, if you value evidence-based advice for men over 50, go ahead and subscribe. I post weekly strategies focused on circulation, vitality, and aging with strength. Now here's the part most men have never heard. What you see in the mirror is often not your true baseline when blood flow is restricted. Tissues stay in a chronically underfilled state. Think of a garden hose with a kink. The hose didn't shrink, the water just can't get through. Aging, inflammation, and subtle shifts in body chemistry create those kinks over time, especially after 50. In the next part, I'm going to explain why acidity, inflammation, and vascular stiffness quietly increase with age and how they directly affect firmness and responsiveness. Once you understand that, the solution starts to make a lot more sense. As men move past 50, there are 3 silent shifts happening inside the body that almost no one explains clearly. And when these 3 line up together, circulation suffers long before anything completely stops working. The first is low-grade chronic inflammation. This is not the kind that makes you feel sick or sends you to bed. It's subtle. It builds year after year from stress, poor sleep, processed foods, old injuries, and even sitting too much inside blood vessels. This inflammation makes the vessel walls less flexible. When vessels lose elasticity, they cannot expand fully when blood flow is needed. That alone can reduce fullness and responsiveness, even if hormone levels look normal on paper. The second shift is increasing acidity in the bloodstream. As we age, kidney efficiency slowly declines. That means the body becomes slightly more acidic over time, especially in men. Over 60, acidic blood causes smooth muscle around blood vessels to tighten. Think of it like driving with the parking brakes slightly engaged. You can still move, but power never fully reaches the wheels. This is one of the most overlooked reasons men feel less vascular strength, even when they're doing everything else right. The third shift is oxidative stress-free radicals damage, nitric oxide, the molecule responsible for signaling blood vessels to open. Many men take supplements to increase nitric oxide, but don't realize the environment inside their blood is destroying it before it can work. It's like pouring premium fuel into an engine with clogged injectors. Now, here's where most men get frustrated. They think the solution is more stimulation, stronger pills, or higher doses. But if the internal environment stays inflamed, acidic, and oxidized, those approaches hit a ceiling fast. This is why I tell my patients, we don't start by pushing harder. We start by clearing the pathway. I've seen men in their 60s and 70s regain noticeable vascular responsiveness simply by correcting these internal conditions. Not overnight, not dramatically, but steadily and sustainably. The confidence shift often comes before any dramatic physical change. You stop feeling like your body is betraying you. This is also where shame creeps in. For many men, they assume decline means weakness or failure. Let me be very clear, these changes are biological, not moral. They happen quietly and predictably. And the good news is they are highly responsive to small, consistent corrections. In a moment, I'm going to walk you through the first practical strategy that addresses all 3 of these issues at once. Inflammation, acidity, and nitric oxide breakdown using something simple and controlled. This is where understanding turns into action and where many men notice the earliest signs that circulation is waking back up. Now, let's talk about the first practical correction, and this is where baking soda comes in. Not as a cure, not as a miracle, but as a tool to shift the internal terrain so your circulation can function again. Sodium bicarbonate works as a buffering agent. That means it gently neutralizes excess acidity in the blood. When acidity drops, even slightly smooth muscle around blood vessels relaxes, relaxed vessels open, wider vessels allow more blood volume. More volume means better fullness, warmth, and responsiveness. This is basic vascular physiology, and it's why this approach works best for men over 50 whose main issue is restriction, not failure. The simplest place to start is the morning buffer. Drink 1/4 teaspoon of aluminum-free baking soda, dissolved in 8 ounces of water taken first thing in the morning on an empty stomach. That's it. Nothing extreme, nothing aggressive. The goal is not to alkalize everything overnight. The goal is consistency. Small daily signals that tell your vascular system it's safe to relax. Many men notice something subtle within 2 to 3 weeks. It's not a dramatic event, but a sense of heaviness, warmth, or faster response. That's microcirculation improving, that's blood, finally reaching tissue that's been undersupplied for years. If the taste bothers you, you can add a small squeeze of fresh lemon. Even though lemon tastes acidic, it becomes alkaline once metabolized, and it provides citrate, which further supports kidney buffering. This combination also helps reduce oxidative stress, which protects nitric oxide from breaking down too quickly. Now, an important safety note. Baking soda contains sodium. If you have uncontrolled high blood pressure, heart failure, or are on a strict low-sodium diet, this is something you must discuss with your doctor. First, this is optimization, not reckless experimentation. Most healthy men tolerate this well, but medical context always matters. The second strategy builds on this internal shift and focuses on local circulation. Tissue health matters just as much as blood chemistry. Over time, congestion and low-grade inflammation can stiffen tissue, making it less elastic even when blood flow improves. And that's why some men feel partial improvement, but not full responsiveness. A warm bicarbonate soak helps address this externally. 2 tablespoons of baking soda dissolved in warm, not hot water, used as a localized soak for 10 to 15 minutes, 2 to 3 times per week. The goal is not penetration deep into the body. The goal is reducing surface inflammation, improving skin and tissue elasticity, and supporting microvascular expansion underneath. Think of it like loosening a tight glove. Once pressure is released, movement returns more easily. Many men report improved comfort and a healthier appearance, which alone reduces anxiety and performance pressure. Here's something important. Confidence and circulation are deeply connected. When a man starts noticing small positive changes, his nervous system relaxes. Less anxiety means better blood flow. This creates a positive feedback loop instead of the downward spiral many men experience. In the next phase, we're going to talk about how this buffering effect enhances other things you may already be doing, including foods, supplements, or prescribed medications, and how timing plays a major role in results. Now, let's connect this to something many of you are already doing or have tried before. Nitric oxide support. Beets leafy greens, L-arginine, L-citrulline, even prescription medications all work through the same basic pathway. They signal blood vessels to open. But here's the problem I see every week in my clinic. The signal is there, but the environment destroys it too fast. Nitric oxide is fragile. In a body with high oxidative stress and lingering acidity, it breaks down quickly. That means the message to dilate never lasts long enough to create meaningful fullness. This is why men often say supplements worked a little at first, then faded or felt inconsistent. The pathway wasn't supported. When bicarbonate lowers acidity and reduces oxidative stress, it acts like a protective buffer. Nitric oxide lasts longer, vessels stay open. Longer blood volume is maintained instead of collapsing quickly. This is where consistency replaces unpredictability. And for many men, that consistency is what restores confidence more than anything else. The timing matters. If you are using nitric oxide, supporting foods or supplements, take the bicarbonate drink about 30 minutes beforehand. You are not stacking aggressively. You are preparing the terrain so the signal can land and stay active. Think of it like watering dry soil before planting seeds grow better when the ground is ready. There's another layer here that's rarely discussed, and it's inflammation-related tissue stiffness, sometimes called age-related fibrosis. Over time, chronic inflammation makes tissue less elastic. Even with good blood flow, stiff tissue cannot expand fully. It's like trying to inflate a balloon made of thick paper instead of latex. By reducing systemic inflammation, bicarbonate helps preserve tissue flexibility. Studies show lower inflammatory markers correlate with better vascular compliance. In plain English, the tissue becomes more responsive instead of resistant. Men often describe this as feeling more natural, less forced, less mechanical. This phase is not about chasing extremes, it's about restoring dignity. Realizing your body can still respond when you support it properly changes how you carry yourself. That shift affects posture, breathing, stress, hormones, and even sleep, which all feed back into circulation. To avoid dependency, the approach I recommend is pulsed use 5 days on, 2 days off. This keeps your body responsive. Without overcorrecting, we are guiding physiology, not overriding it. What I want you to notice is how everything so far works together. Internal chemistry, vessel relaxation, tissue elasticity, nervous system, calm. No single step does all the work. The system improves as a whole. In the final part, I'm going to give you a simple 30-day plan you can actually follow without overthinking and explain what realistic progress looks like so you know you're on the right track. And not chasing myths. Let's bring everything together into a plan that fits real life, because the goal here is not perfection, it's momentum for the first 14 days. Keep it simple. Each morning before coffee or breakfast, mix 1/4 teaspoon of aluminum-free baking soda into 8 ounces of water. Add a squeeze of lemon if you like. Drink it slowly. This is your internal reset. Think of it as loosening the system, not forcing a change. During this phase, pay attention to subtle signals, warmth, heaviness, quicker response, or even better morning energy. Those are early circulation wins. During weeks 3 and 4, continue the morning drink, but add the external soak twice per week, 10 to 15 minutes in warm water with 2 tablespoons of baking soda. Nothing more. This supports tissue flexibility while your internal chemistry is improving. Many men tell me this is when confidence shifts, even before dramatic physical changes show up. If you are already using nitric oxide, supporting food supplements, or prescribed medication, keep doing so, but pay attention to timing. Buffer first, then signal. You may notice things feel more reliable, less hit or miss. That's a sign the pathway is working as a system. Now let's set expectations. Honestly, this is not about turning the clock back to 25. It's about restoring your body to its current best function. Most men notice meaningful changes between 2 and 4 weeks. They're gradual, but they're real, and they tend to build instead of fading. The biggest mistake I see is men giving up too early because the change wasn't dramatic enough, fast enough. Remember, circulation health compounds. Every day you reduce restriction, you make tomorrow easier. If you are the type who wants the minimum effective effort, stick with the morning drink alone. That internal shift is the most powerful lever for vascular health in men. Over 50, everything else is supportive, not mandatory. I want to say this clearly. Aging does not mean surrendering vitality. It means being smarter about physiology. You are not broken. Your body is responding to years of small stresses, and small corrections can create meaningful improvement. Before we wrap up, I want to hear from you. Which step are you going to start with? The morning drink or the soak? Drop it in the comments and tell me where you are watching from in the US or around the world. This community matters. If this helped you understand your body better, please like and subscribe. I share evidence-based strategies every week for men over 50 who want strength, confidence, and dignity as they age. And finally, share this with one man you care about. Too many struggle in silence. Thinking decline is inevitable. It isn't. I'm Dr. Selena Clarke. And remember, vitality is not a destination, it's a practice. Before we close, let me remind you, this video is for educational purposes only. It does not replace medical advice. Every man's health situation is unique. If you have medical conditions or take prescription medications, please speak with your healthcare provider before making changes.